1 year back, she had sugar problem. So she was having collection of pus in her legs. So for that, there was surgery was done in her country, Kyrgyzstan, but it was not done right way. So they left a piece of bandage inside, and after that there was infection, and the condition was very bad, deteriorating very much.
My name is Dr. Ashish Chaudhary. I am heading the Department of Orthopedics at Akash Healthcare Super Specialty Hospital, New Delhi, Dwarka. Today I am going to talk about a very interesting case of a 30-year-old female, which she came from Kyrgyzstan. And when she landed at our hospital, she was in a very bad shape. So much so that the entire face, the arms were swollen, the legs were swollen, the left thigh was completely deformed. There was pus pouring out from multiple areas, especially the left forearm, left thigh. So much of distress while she was talking. She was having breathlessness, she was having fever, she was having urinary tract infection, and so many medical complications that we were really worried at the time of first presentation. We were not sure whether she'll be able to survive for a long time. And then, we involved multiple consultants, including our medicine team, Dr. Prabhat Sinha, and the complete orthopedic team also, went in and first of all evaluated the patient's condition, both medically, surgically, and we found, to our surprise, the entire lung on one side was collapsed. There was fluid inside the lung, there was pus collection all over the body, and so much so that we were able to find on the ultrasound almost 50 ml of pus in the left forearm, and even the right side was fully swollen, red, edematous, and suggestive of infection of the skin at multiple areas. We could see an old surgical scar over the left thigh along with some drain which was lying there, and it was pouring pus. The leg was deformed and patient was completely bedridden for a very long time. We got to know that she suffered an accident a few months ago, and in which the left thigh bone got fractured. She underwent multiple surgical procedures, but ultimately landing in overall generalized infection of the body spreading across various organs. So there we first of all did the blood test, did radiology test, and we found that the left thigh bone was completely shattered. It was the bone was not united. There was a lot of infection around. And then when we found the blood test, patient was very low on protein. The blood white blood cell count was very high. That means it was suggestive of severe infection. And so many other parameters were deranged because of the complete bedridden state for many months. And then we talked to our medicine consultant, and first of all we improved the general condition. We reduced the fluid from the lungs. We did the pain management. We gave antibiotics, high-grade antibiotics, because there was gram-negative bacteria growth, and so many bacteria growth we found on the testing. And after having the complete medical stabilization, then we went ahead, opened the left thigh, saw the dead bone there, removed the bone, and to our surprise, the moment we opened, we found a piece of gauze, a cloth material which was stuck inside the bone. I think that was the gauze piece which started the entire story of infection, and because of that foreign bonding, the patient suffered so many complications which I just mentioned. So in the stage 1 of the procedure, we removed the stuck foreign body, the gauze. We removed the dead bone, cleaned up the material, put in antibiotic beads, cement spacer, and a temporary stabilization was done. Thereafter, for 4 to 5 weeks, we were regularly monitoring the patient, giving antibiotics. And after complete recovery from the infection, then we went ahead again, went inside, removed the spacer, put the new bone graft, put the plate, and stabilized the entire fracture. And thereafter, we have been managing the patient conservatively with the help of our physician colleague. And today, at the end of 3 months after the procedure, second procedure, patient is hale and hearty, able to sit, able to take the normal meals, and also for ambulation we have advised for walking with the help of walker. She's able to walk few steps in the room, go to the washroom, and I must say the entire experience of last 8 months since the time we have seen the patient for the first time, gradually the medical condition improved. and thereafter the surgery was done to correct remove the source of infection, and thereafter whatever damage to the bone was there, we did the bone grafting, we did the plating, and thereafter we managed all the aspects, not only the infection, the nutrition, the rehabilitation, the posture correction, and after all these efforts, a multidisciplinary approach effort, we were able to give a hale and hearty limb and a good lung, a good healthy stature to the patient, and now the patient has happily flown back to her country.
Спасибо большое, Akash Clinic.
So I extend my thanks to Akash Hospital, Dr. Ashish Chaudhary sir. That's all.
Очень хороший. Вот.
But